Benoit Champigneulle. It's a difficult one, also for me. He is from Grenoble. He grew up in Paris, and he will talk about hypothermia. He will show you the guidelines, and he will not talk that much about avalanche, because there was a huge change in the avalanche rescue at the moment, or is it? But maybe we have time then tomorrow in the workshops for this. Thank you very much.
Thank you, Hers. Hello, everyone. I'm very glad to be here to share with you some general consideration about hypothermia, especially in the mountain environment. And to introduce it, I'm sure that you well know that in mountain, the temperature will decrease with altitude of about 1 Celsius degree by 150 meters of elevation. But we need also to consider the wind due to the wind chill effect. That means that there is an absolute temperature, and if you have a strong wind, you will also have a decrease of the felt temperature due to this effect that will increase the heat loss by a convection mechanism. So when you have a cold weather with a lot of wind, it's possible to have a fast cooling if you are not well geared. So what is the main mechanism of thermoregulation of the human body? To speak about it, we need to consider that there is 2 compartments in the human body. There is the core, that is the most important compartment, the central compartment, who contain essential organs as a brain, thoracic, and abdominal organ. And around the core, you have the periphery, the shell, which include the limbs, skin, and muscle. You know probably that human is homeotherm, and the temperature of the core in human is tightly regulated to be close to 37 degrees. And this regulation is due to the hypothalamus, a small part of the brain. And to maintain this core temperature, the shell, the periphery will act as a buffer, and the temperature of the periphery will vary a lot, depending first on the environment, and secondly to the internal heat production, when, for example, when you have a fever or when you perform physical exercise. And the temperature exchange between the core and the periphery is mainly mediated by the constriction or the dilatation of blood vessels leading to peripheral tissue. So finally, the core temperature is a balance between the heat production and the heat loss, and we have a 4 mechanism for its loss. At rest, the most important mechanism for heat loss is the radiation. It consists to a transfer of heat by infrared waves from the body to the cooler object in the surrounding area. There is also the conduction mechanism, which consists of a transfer by contact of the body with an object, for example, snow or rocks for cold object, of a lower temperature. The convection mechanism is maybe more tricky to understand. It consists of a transfer of the thin layer of the air next to the patient's skin, which will move and carry away from the body when you have a lot of wine. And this mechanism is highly depending on the body surface exposed to the wind and to the airflow, of course. And for finishing, the evaporation mechanism is the vaporization of water, mostly by sweat. And also in a cold environment, you can have some heat loss by evaporation through the respiratory system. So finally, hypothermia will occur when the heat loss will be greater than the heat production. And we strictly define hypothermia as a core temperature between below 35 degrees Celsius. In the mountain environments, the decrease in heat production may be favored by exhaustions, by depletion of energy reserve, by dehydration, or by inactivity. And there is some human defense against hypothermia, as a shivering. This is a very energetic, costly mechanism and few efficient for rewarming, and also distal vasoconstriction, who can lead to frostbite. We will see that in the next talk. So in the mountain environment, we can show hypothermia in some specific situation, like avalanche burial, trauma, fall in crevasse, or when people are lost in the blizzard. How to recognize hypothermia? It's often very difficult to measure the temperature in the field, and the peripheral thermometers often give not a good temperature, so it's not reliable. And clinical things well correlate with the degree or stage of hypothermia, and we can use a clinical thing to assess the degree of hypothermia. So we have a 4 stage of hypothermia. There is also a 0 stage when you have just called a suicide. In this case, you have only intermittent shivering and you are able to care yourself. You are conscious. When you have mild hypothermia, stage 1, your temperature is approximately between 32 and 35 Celsius degree. And the victim is conscious and have constant shivering. In moderate hypothermia, stage 2, the temperature of the core is estimated between 28 degree and 32 degree. The victim will have an impaired consciousness, and the shivering will stop below 30 degrees. There is a moderate risk of evolution towards cardiac arrest. And in stage 3, it's a severe hypothermia. The temperature is often below 28 degree, and the patient will be unconscious, but with vital things. But sometimes vital things are difficult to find due to bradycardia, due to a low breath rate. So when you're looking for vital thing in a cold and unconscious patient, you need to take time, and it is recommended to assess vital thing during 1 minute. And it's stage 4 hypothermia. The victim is very hypothermic with often temperature below 24 degrees, and the patient is in cardiac arrest due to hypothermia. So to resume, hypothermia is a life-threatening condition that may lead to impaired mental status, progress to comatose state, and lead to cardiac arrest in most severe cases. To prevent hypothermia, the first thing is to use adapted clothes, and probably the multi-layer clothing system is the best method to use. And of course, you need to have adapted clothes, adapted gear to the environment. Don't forget also to replace wet clothing with dry clothing, and to cover yourself when you stop exercise. And don't wait until you are cold. Don't forget to cover the head, because a lot of heat loss provides from the head. Things to increase its production by exercise: add fuel, so heat. Stay hydrated, drink, but no alcohol. And add warmth by drinking a warm beverage. How to avoid hypothermia? You need to extract yourself from wind and cold. And remember that to build an emergency snow shelter or a survival snow case may protect you against hypothermia and save lives, especially when you are lost in the blizzard. What about trauma? Trauma is frequent in mountaineering activity. We need to consider that all injured people are at high risk of hypothermia or are already hypothermic, independently of the trauma severity, even in summer. We often forget that it's also possible to have hypothermia when you have a trauma in summer. And it's vicious because when you have a trauma, it's you cool more easier, and after hypothermia will worsen blood loss. And it's well known that hypothermia will increase the mortality in trauma patients. In medicine, we speak about the triad of death, including hypothermia, acidosis of the blood, and blood clotting abnormality. So systematically apply preventive and or corrective measures against hypothermia in injured patients. How fight against heat loss? So it's not easy to understand. We need to fight against a heat loss mechanism. So we need to insulate the patient from the ground, from the rock, from the snow, using what you have under the hand, backpack, rocks, sleeping mat. And to fight against the other mechanism, you need to things to remove white clothes. You need to use vapor barrier to avoid moisture on the insulation. So you can use reflective blanket, you can use plastic bag. In medical rescue in France, we use a lot of bubble wrap for heat. And you need to insulate the victim with a supplementary parka, blanket, or sleeping bag. So how to treat cold patient in the field? For cold-suicide patient, they are able to care by themselves. So you need to give them a dry supplementary clothing, to give them some fuel, some things to eat and drink, and they are able to move by themselves and to perform exercise to warm up. For mild hypothermic patient, so these patients are also conscious. They have impaired movement, and they are shivering during all the time. You need to handle them gently. They need to stay at rest. You need to use insulate and vapor barrier. Give them something to eat and something to drink. You can give heat if you have some system to give it in the trunk, in the torso. And you need to monitor them and evacuate them if there is no improvement in the next 30 minutes. For the more severe patient, regarding moderate hypothermia, these patients are at high risk of aggravation, of degradation, due to the risk of afterdrop. What is afterdrop? Afterdrop is further cooling after a rescue due to the mobilization of the patient and due to the mobilization of cold blood from the peripheral to the core. So we need to handle them gently. We need to keep them horizontal. We will not give them drink or food because they have most of the time an impaired conscious. We need to give them heat to the upper trunk, and we need to evacuate them carefully. These patients are especially at risk of cardiac arrest by ventricular fibrillation if the temperature drops below 30 degrees. And for the severe hypothermic patients, they are at high risk of rescue collapse if they are not in cardiac arrest at rescue time. We need to treat them as a moderate hypothermic patient, and we need to check vital sign during at least 1 minute. And if there is no vital sign, these patients are in cardiac arrest, and we need to start CPR. And if they have spontaneous circulation, this patient need to be evacuated as soon as possible. And if possible in an hospital with an extracorporeal circulation facility that is not possible in all places around the world. How to perform an active external rewarming on the field? There is some hypothermic wrap system. This is a picture from the recent guideline from the Wilderness Mountain Society. So their suggestion is to apply a heat pack next to the patient's skin. Be careful with the risk of burn, of course. Then after, you will use a layer with a vapor barrier, so you can use a security blanket, for example. After, you will add a wrap for insulation with sleeping bag, for example. And to finish, you will add an external vapor barrier to protect them from snow or wind. What about hypothermic cardiac arrest? So, said that below 30 degrees or 28 degrees, there is a high risk of cardiac arrest due to ventricular fibrillation or asystole. Detection of cardiac arrest may request a prolonged assessment in this cold patient. But there is a good news, that is that hypothermia have a very good neuroprotective effect, and you can have a good outcome, a good neurological outcome in a patient when hypothermia is the etiology of the cardiac arrest. Of course, the prognosis of this patient is better in case of accidental hypothermia due to exposure than when hypothermia occurs during burial in avalanche due to some confounding or aggravating factor like hypoxia and trauma. And for this patient, the best rewarming method after hospital arrival is to implant an extracorporeal circulation. The abbreviation is ECLS for extracorporeal life support. And now we have some survival score. We can help us to define which patient which patient could benefit of this kind of highly costly method for rewarming. One other thing to know, especially for a rescuer, is it possible when you have a patient in cardiac arrest due to hypothermia to perform only intermittent CPR, only intermittent cardiopulmonary resuscitation, if it's not possible to perform a continuous CPR due to difficulty for extraction and evacuation of the patient. And there is also a very good survival described in the literature for patient who had intermittent CPR, especially in the French Alps. There is also some specific guideline for avalanche rescue to know which patient could benefit for a CLS, for extracorporeal circulation, and to know which patient need to be quickly transported to the hospital under chest compression. There is some evident reason to do not initiate CPR in hypothermic cardiac arrest patient, especially when there is obvious sign of death, or when there is unsafe condition for the rescuer. So to finish, don't forget to consider wind chill and not only the absolute temperature. There is full mechanism of heat loss, evaporation, radiation, conduction, and convection. Clinical things allow to estimate the stage of hypothermia. Injured patients need to be considered as hypothermic. Hypothermia increases mortality in trauma. It's very important to remember this. Insulation and vapor barrier are effective for activating in the field. And hypothermic cardiac arrest may have good outcome despite prolonged duration of resuscitation, so initiate and don't stop CPR. There is some additional reference to know more about, and I thank you for your attention.